Finance Minister Enoch Godongwana has allocated a total of 848 billion rand for the health sector. Now, broken down, 11.6 billion rand is set aside to address the 2023 wage agreement, 27.3 billion rand for infrastructure, and 1.4 billion rand for the NHI grant. To discuss the state of health and whether this budget allocation will address some of the pressing concerns in the sector, I'm now joined by the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, very good morning to you. Welcome to Newzroom Afrika. What's your assessment of Minister Enoch Godongwana's budget? I mean, we heard how extra money for health workers will be allocated, but on the other end, the sector's budget shrinks in real terms over the next 3 years.
No, thank you so much to you and morning to you and to your viewers. We welcome the move to honor the 2023 wage agreement and, an allocation also to improve the nation's infrastructure in the health facilities. We think that, there is some movement, even though we think, it's very minimal. If you consider the amount that was touted by the minister in Parliament somewhere last year when he said they need about 200 billion rands to attend to the infrastructure of the country. Now, to be getting that amount allocated, we think it won't really do anything, in terms of, or do much in terms of achieving what the minister was looking out for. But we also believe that the 1.4 billion rands that was allocated to NHI grant by government, we think, it's not really a serious amount of money if you look at it, because we're talking about an estimation of about 500 to 800 billion rands for the NHI. So it means if you look at this 1.4 billion, actually it's an amount that you can give to salaries to doctors for just 1,500 doctors will benefit from that amount. You're not talking about nurses, you're not talking about other healthcare professionals. So it's a drop in the ocean if you look at it. Yeah.
With that drop in the ocean, I mean, we know how much pressure there has been for doctors who are unable to find and secure jobs with the state. How sufficient is this extra money to benefiting and hiring the recently qualified doctors, for one, who've been unable to secure jobs with the state? Are you talking about 1,500 of those who will now be hired as they are new graduates and now want to be roped into the system?
Well, at the moment, we are told that we are sitting at there's around 1,000 unemployed doctors. But, we could have more of those because you remember we still have some who were left behind who may have qualified or even finished their community service at around February, March and stuff like that. So, but we hope that they are going to absorb all those doctors. But the issue is not about the unemployed doctors now only. Mm-hmm. We should be, forward thinking in terms of how we plan for the future graduates in healthcare to see how can we populate those, especially if we are looking at the primary healthcare, to rebuild primary healthcare. With the shortages of nurses, shortages of doctors, I don't think we are going to achieve what we want to achieve. But we also, our position has been affirmed by what was said by the minister when he spoke of the allocation to the infrastructure. Because we're always telling government that you can't be telling people that you want to implement NHI when you have dilapidating hospitals, you have shortages of staff, you have leadership and governance problems. But, even allocation of money is not enough. We should be attending to other pillars of the healthcare system so that we are strengthening our systems as we move towards a reform.
Yeah. With all those challenges that you make mention of, insofar as the NHI is concerned, I mean, the budget review contained no new provisions for the NHI, although we know that Finance Minister did recommit to the policy. That in itself is sort of almost a misalignment. I mean, recommitting and then no new provisions. Where does it place the sector?
Well, like we've been always saying, to say it's not enough to be legislating your way out of the crisis. Because that's what we are seeing at the moment, where people are excited about the president getting a pen and signing. But it does not change people's lives. We've seen that we've got the National Health Act that talks about how primary health care should be run. But it's just a legislation that is sitting there. Nobody is implementing. So our issue is not really an excitement about a new legislation that is coming out. In fact, that we know that is done for election purposes. It has nothing to do with a reform. So hence we are saying, if we are serious about the lives of our people in South Africa, consider a true reform. And if we are going to consider a true reform, we must see first politicians stopping going to Russia, stopping going to Cuba, stopping going to Thailand, for their medical care. They must use their system. They can't be messing up the system and running out of the country, when they have serious problems, healthcare problems.
So while National Treasury has made good on Minister Joe Phahla's promise to ensure that there are more doctors which are hired, how much pressure does it now place in the sector? And what sort of dilemma will this move pose for provincial health departments? Because, you say it's a drop in the ocean.
Well, we know, Mpo, that even though this is called the NHI grant, what we have learned from the past is that, it's just a label. When it goes to provinces, they can repurpose that money for other things. So we see it as just, a label, not really that it is really intended for the purpose that is purported to be for. So we hope that in at least whatever they do, they'll be able to absorb more of healthcare professionals, especially the unemployed doctors that are out there, where, you find that we have a serious problem in our hospitals. There's a problem of burnout from our colleagues who are employed. And at the same time, we've got these colleagues who are sitting at home and, fully qualified medical professionals who are not doing anything, sitting at home. I think it's a waste of people's taxpayers' money. And I do think that we need to correct that by inviting those and employing them at the stage, because that's where the dash of it is at the moment.
Yeah. As we go deeper into some of the other parts of the health sector and how finances will be affected, we heard that the HIV/AIDS component of the District Health Service grant has now been cut by 1.3 billion rand a year over the medium term as a result of a number of people being on treatment and significantly below the target. Is that a justifiable move?
No, I don't think it's a justifiable move, especially because you are not sure if the PEPFAR funding is going to be authorized, by the U.S. authorities. So, to be spending less, in terms of HIV, when we are the hub in terms of, the infections in the world, I don't think it's a very intelligent idea. I thought that, when it comes to healthcare, you would make sure that you avoid anything that would be complications, where people will get sick and be admitted to hospitals, but even be taken to ICUs, such expensive resources of the country. So you would want to make sure that everybody is covered, but also you follow on the World Health Organization's targets of 95, 95, 95. You can't be running away from that. You can achieve, in fact, that if you're spending less on that, it must be an investment, intentional investment by South Africa.
Yeah, very well. Thank you so much for weighing in on this discussion. Reaction later, the budget speech insofar as the health sector is concerned. Dr. Mvuyisi Mzukwa of the South African Medical Association, the chairperson, giving us his reaction.